It is January 5th. I just pulled up to my doctor. I have about 5 minutes before I can go in. I have my 12-week ultrasound appointment. I don't know if they do an ultrasound today because I just had one last week for like the spotting that I was having. That has been figured out. I'm just really tired and I'm starving, but I think they're taking blood today. I don't really remember. I've been here so much, like so much. My medical bills from last year, we paid a lot out of pocket. Well, not nearly as much as like it would have been, but we paid a lot of money out of pocket, and that's still considering with like really good insurance. So I'm just, you know, very grateful for that, and just reminding myself that, like, you know, every year that I pay all this money into my insurance and I don't really use it, I made up for it in 2020. Like, my one surgery I think was $20,000, and we paid, I think after all the different tests and everything, it was like $2,000. That was just the surgery, and then all the different biopsies and appointments I've been, and then a miscarriage. I mean, I'm just very grateful that we have good insurance, even if we pay a lot for it. You never know when you're gonna need it. So, I don't know. Anyways, I'm gonna go in and check on this baby. The kids are literally asking me every day, multiple times a day, how's the baby? How's the baby? How's the baby? How's the baby doing in there? Is it coming out yet? It is so cute, but 6 months of these children like interrogating me. Whew. They're great though. So I have to come back. So starting the 19th, so in 2 weeks, I go every other week for an ultrasound. So it's gonna be a lot of ultrasounds, a lot of photos and checking in on baby, and yeah. And this is because of my history with miscarriages, and then my history with my cervix. They basically have to monitor my cervix really well. They decided after talking to the hospital where I had my surgery done that they are not going to put in a stitch. I forget what the actual terminology is called, but basically when I had my appointment at 7 weeks, they said that they were thinking about putting a stitch in to make sure that my cervix just didn't like randomly open too soon. She said that because we're not doing the stitch though, we need to monitor it. So every other week I'll go in and have an ultrasound, and honestly, it's not the worst thing, right? I mean, it's not the worst thing. People want to see ultrasounds like all the time. She said that it's not considered high risk. It's just there's, you know, precautions that we're taking. Yeah, so we did genetics. I should know in like 10 days. She did say that she'll call and tell me everything. But she was like, be careful if you don't want to know the gender. If you open up the test results, like it'll tell you the gender. And I was like, no, I don't want to know it. But now I'm like, shit, it's gonna be in my like email. Jarek wants to know. I don't want to know. I just like, this is just something that has been years of waiting. I just feel like I don't even care. I can wait another 6 months. I just think the surprise of itself will be just like something so exciting to wait for. You know, am I gonna be a boy mom still? Or is it like, oh shit, I got a duplicate of me coming into this world? I don't care either way. I just want a baby, and a healthy baby. So yeah, Jarek really wants to know. I don't. We'll see how it goes, but it's pretty exciting. This road is very rocky and it's shaking the camera, but anywho, back home to work I go. Good morning. I am 12 weeks today. Actually, no, I was 12 weeks yesterday. I'm feeling kind of large today. I feel bloated though, honestly, like I need to poop or something. When I was 12 weeks with Trayson, you didn't even know. I didn't even know, to be honest. So, There the belly is. I am at fetal imaging because they're seeing my cervix. Oh, I thought I pushed this. It's shortening, so I think we're gonna have to do the stitch after all. Hola! Hi! It is February 10th. I'm headed to CVS right now. We just got home and I already forgot I had to go to CVS and get my prescription. Last week I was 15 weeks and I had my every 2 week appointment that I have to have now. It's basically to check my cervix every other week to see that it's good after the surgery that I had. It's been fine up until last week. It was short. Apparently it went from like 30 millimeters to 24 and they like it to be 25 and higher. So they referred me to a maternal fetal medicine imaging type place. So they referred me to there and I went there today and I had ultrasound on top and then vaginally. Everything looked good with baby. My cervix hasn't changed from last time. It's still short from last time, but it hasn't like gotten shorter. Basically, I am going on vaginal progesterone every day now until I have a baby. I am now going from every other week to every week appointments. So that is the update. I am 16 weeks and 2 days today. We will do whatever it takes to keep this baby inside of me. Yeah. Oh, hot. It is February 19th. I just got to my doctor's appointment. It's 8 a.m. Yeah, I'm 18 weeks. I'm here for another ultrasound. I've been on suppository, I think that's what it's called, vaginal progesterone meds for a week now, hoping that when we do the ultrasound today that my cervix is not shortening anymore. Otherwise, we will have to do the surgery is what I've been told. Fingers crossed. All right, folks, let's go check this baby out. I've been sitting here for an hour and a half, I think, waiting for the doctor to come from the hospital. They're like, it'll be like 30 minutes at most. I'm tired. I need to eat. I need to go home and work. I still don't know where he is. If this couldn't just be a conversation over the phone. I am all checked in. Just waiting on my COVID swab to come back. The nurse is really nice though. She was like asking about my due date and she's like, oh, what do you want it to be? Do you want it to be a Cancer or a Leo? I'm like, I like you. I like that you're so focused on the horoscope. Anywho, we're here in this, you know, great outfit. Just waiting. My nerves have kind of like calmed down. I feel better. It is March 1st. I'm headed to my ultrasound appointment today. 19 weeks today. I have an ultrasound. This is my anatomy ultrasound. Jared can't be here, just like everything else. This is like so annoying, but it is what it is. Yeah, so it's like the big one. They obviously have been having ultrasounds every week since like 8 weeks, but they obviously don't go in depth when they are looking at the ultrasound then. So I'm sure if they had like seen some concerns, they would have looked into it then, not just now. But okay, everything everything went well. It's so annoying because I have so many different specialists like appointments that I've had. All the appointments are getting mixed up on like who's checking what and what's doing what, And apparently I was supposed to see my doctor after the ultrasound. Anywho, we're going home. Everything looked good. All the stuff in the heart looked good. The chambers, the placement of the heart, the liver, the fingers, the toes, the legs, the head, everything was good. So now I'm gonna go home, get back to work, come do this all over again tomorrow. Not at all, but another appointment.
To the baby.
No, they're moving. I'm just trying to see.
How do you see?
I'm watching my belly move.
Hello. Hello.
No, thank you. Hello. Wow, I haven't vlogged in a really long time. Today is June 29th. I am 36 weeks and 1 day. And I'm actually headed to my OB right now for my 36-week appointment and to get my cervical stitch removed. I've been just physically and mentally tired. Exhausted is more like it. I started seeing the chiropractor to help with like lots of pelvic pain and like hip pain. Big old belly. I am back home from the doctor. Let's see. Everything was supposed to be like a routine. They just like clip the stitch and then you pull on it in a little and it like slowly comes out. And I remember I've asked this so many times, like, it's not another surgery, right? And she's like, no, it's not. Like, it's really easy. It's an in-office procedure. Blah, blah, blah. Wow. Not for me, it's not. Basically, I'm already at a 3 dilated. However, I did not think you could dilate with the stitch in. But she kept trying to like look and feel for the stitch, and she kept saying, are you sure it didn't fall out? And I'm like, is it colorful? Like, I don't know, what is it? And she's like, yeah, it's like a purple stitch. And I'm like, no, like I would have noticed that. She and another doctor tried finding the stitch and taking it out, and basically they can't safely in the office because even if they had like all the tools that they have in the hospital to safely remove the stitch, because I'm just like so tense and like my body's like obviously like stretched, or like my body is stressed out when, you know, she's trying to find the stitch. She can't see it. She said that she finally felt it, which was, God, my vagina has just had so many things, like hands and tools in it in the past 18 months. It is so sore. She said that it tore the stitch and it's embedded like really deep in my cervix. And because of that, and because I'm dilating already, they have to get it out like right away. If they don't, she's like, you can have the baby, like you'll go into labor and you'll have the baby, but she was like, your cervix will be blown, or like, what did she say, blown or ripped to smithereens. So, and then I'd have to have reconstructive cervical surgery. I don't want that. No. So I go into the hospital tomorrow for the removal of the surgery, or of the stitch, which I really didn't want to do, but obviously I don't want my cervix blown to smithereens as well. So I'll have another spinal so that she can remove it safely. But the good news is tomorrow I'll be 36 weeks in 2 days. I had Trayson at 36 weeks. I had Sky at 37 weeks, and it was like night and day difference. I have a lot of like PTSD from Trayson's birth. Maybe not so his birth, but him being in the hospital, in the NICU for 10 days. Like, I just have a lot of stress like built up around that. And so like anything past 36 weeks has always been my goal, and I've just been very like anxious about that. Yeah, sitting in my underwear in bed, working still. I have a lot of stuff. I'm trying to like get a huge email out with like all this stuff that I've been working on just in case we go into labor, but we're not going into labor. We're getting a stitch removed. That's it. That's it. I'm trying to think, when do you think you're coming? When do you think?
Look how pointy. It's like so pointy.